Welcome to Module 4. Congratulations, you have finished half of the course and just three more modules left to go. And these will be really fun because here's where I give you lots of tips, lots of options regarding materials and treatment planning that you can implement in your practice starting Monday. This module is about preventative dentistry as well as treatment planning. So I hope you're ready for it. Learning objectives. We will talk about preventative strategies. I'm going to harp a lot on prevention over here. We will talk about caregiver education, which actually needs its own little lecture because it's so important. And I'll go over why it's so important in just a little bit. Treatment planning as well as materials that I like to use in practice. Prevention game plan. Why is it important and how do we go about it? Remember in previous modules, we talked about how some patients will not be candidates for sedation or operating room dentistry. That is one reason why we want to try and prevent things from getting worse and worse and having to see them in the hospital. Another thing to remember is that going to the OR for a routine dental visit just cannot be justified. Just because patients are exhibiting behavioral or sensory issues, we cannot simply refer them to a hospital for them to be seen at the hospital to just have a cleaning. It cannot be justified at all. Insurance would never pay for that. And even if it weren't about insurance, it's simply a big waste to our hospital system's time. Our hospitals are completely packed with patients who have to go through all kinds of treatment. So, for us to be sending patients for these small cleanings that can be done in a dental office with some desensitization, we cannot be doing that kind of stuff anymore. I hope you can understand that. And it's also never too late to start a good habit. Of course, it's hard. It's really challenging to start new habits at the age of 40, right? Which is why we really lean on our pediatric dentist counterparts. You can tell when a patient in their 30s comes and sees us and they have beautiful teeth, they have behaviors and sensory issues that are very well controlled. They know what to expect at the dental visit. You know when you see patients like this that they have had fantastic pediatric dentists. But many of our patients have not had that opportunity. They have not had any kind of routine dentistry their whole lives up until that point. So, guess what? Now that they're adults, we have to help them build those habits as their general dentist. Another thing about prevention is that you want to secure your dentistry. And I've mentioned this before, but sometimes you will see patients and do full mouth of treatment for them, and we'll be so pleased with ourselves only to find out that they will come back to you a year later or maybe in 6 months for a recall, and most of that dentistry has failed. Now there's recurrent carious lesions underneath fillings, underneath crowns. Things are looking really bad. And guess what? It's not just you that's frustrated. The family is upset too because they're like, you just finished all this treatment 6 months ago or a year ago. Why are we doing this again? And it becomes really hard for you to say that their oral hygiene at home is terrible. That's the reason we have to do this again. So we have to actually give patients those resources to make sure that they are securing our dentistry. We need to give them water picks, toothbrushes, floss, toothpaste, sometimes rinses. We need to give them opportunities to rinse their mouth 3, 4 times a day after every meal so that they're keeping their mouths as clean as possible during the day. And unless we educate patients in advance about this, they are not going to magically start doing that because remember, most of them, when we are starting to see them as general dentists, are in their 30s, 40s, 50s. These are brand new habits that we are trying to instill. So it's going to take some time and we need to educate them about it. Um, if things look great from a prevention point of view, then you're going to keep patients and their families really happy. They will refer more patients to you. You will have a very busy practice. Something that most of us are not doing, and I will be the first to admit, I used to never ever do this before I started seeing patients with special healthcare needs, was nutritional counseling. We really need to be playing a role in educating our patients about what they should be eating and what they really should try to avoid. And if they do eat stuff that is sticky, soft, then they need to really be cleaning their mouths right after so that they reduce their risk for cavities. This is super duper important, and we really don't do enough of this when we should. Educating caregivers on how to use three-sided toothbrushes. I do have pictures of it in a few slides. Or using routines such as bringing the patient into the bathroom, watching themselves in the mirror and brushing their teeth instead of brushing their teeth in bed. So, establishing a routine or maybe singing a song that this is the way we brush your teeth, something that you would do with your kids or with a toddler. Doing that same thing with the patient can actually help them establish a routine. They understand that, okay, in the morning and in the night, I have to have my teeth brushed. And sometimes you need to remind patients to do this because remember, a lot of our patients are undergoing cognitive declines. So, if it's someone that has dementia, maybe up until the age of 40 or 50, they were doing these things just fine. Suddenly, at the age of 50, now that they have dementia, they are no longer remembering to brush their teeth. They have the motor skills for it, but they cannot make the cognitive attachment to it or the connection to it. And now they need a caregiver to help them remember how to brush their teeth again. So, educating caregivers is super important. Another side note is that a lot of our caregivers are not born and raised in the US. They're coming to us from lots of different countries. They're coming to us from different cultures and speaking different languages. And oral hygiene practices differ quite a bit in different countries from what we learn over here in the US. So sometimes educating caregivers on 2 minute brushing all of the back teeth and the front teeth, having them rinse with a mouthwash, flossing teeth, and the different kinds of toothpaste that can be used. All of this is very critical. It sounds silly when we try to educate people about this when they're adults, right? But believe me, there is a lot of value that needs to be gained. So we can definitely do that by educating our caregivers. Um, I will also sometimes put in a prescription for mouthwashes or specific toothpaste. I know a lot of us are doing that for high strength fluoride toothpaste anyway, so I won't talk about that. But mouth rinses are something that are not typically done as a prescription, but I will sometimes do it as a prescription because when it's on a prescription, it gets done by the caregiver. When they see that there's a prescription for it, they will automatically follow instructions versus you just telling them, oh, get Stella Life and have them rinse 3 to 4 times a day. Maybe it's going to get missed if there's not an RX on it. If there's an RX, it will not get missed. Just a side note for you guys. This is one of my favorite toothbrushes. Lots and lots of different companies make this three-sided toothbrush, but it's perfect for when somebody's teeth need to be brushed by another person because it does the role of going on every side of the tooth at the same time quite well. I also have all of our caregivers, whoever we meet, I will give them a sample of the open wide mouth prop and have them use it for patients with cerebral palsy or patients who are sometimes really, really tight around their muscles and have a hard time opening. I will give them this, I will show it how we use it, and then they can subsequently buy the, remaining disposable mouth props. The caries risk assessment, I know a lot of us maybe last did this in dental school or in residency. Um, or at a pediatric rotation in dental school, but there is a lot of value that you can gain from this form. It also really helps to have this form in your chart because it can justify the kind of treatment that you're offering patients. It's great for quantifying dental disease, great for patient education because there is a nutritional component to it. There's a medication component to it. Drug and alcohol abuse is on it. So lots of things can come up to your patient's minds as well as your own mind when you start to fill this out. And it's also very good for staging treatment. If you start noticing that patients are on medications that typically cause xerostomia, you will have a different methodology of how you want to stage certain kinds of treatment. Maybe you want to start with certain smaller treatments first to see how the patient does, if they're complying with their oral hygiene instructions at home before you do some of the bigger cases, or you start working on anterior teeth, for example. So, overall, just a very good idea to have in your toolbox. And with that, let's jump to our case study in this module. One of my patients had told me the first thing that he said to me when we met was, I just want to get my life on track and I want to find a job and I need my teeth to be fixed before I can find a job. Sounds like a pretty decent question, right? He just wants to get a job and needs good teeth in order to do that. So this is an FMX that we were able to get on my patient. As you can see, there are some very new looking extraction sites, right? You can tell that these teeth were very recently pulled. You can kind of still see the socket around it. And you can see that there's a lot of cavities. You can see that there's definitely some stuff going on in the anterior teeth. You can see the start of some cavities under existing fillings on the back teeth and some pretty big interproximal decay out here as well. So you're starting to see a picture of what's going on. These are intraoral photographs. Again, you can definitely tell that these extraction sites are pretty new. They're very raw looking. And this is a telltale sign for me, this enveloping cervical inflamed gingiva, which typically tells me that maybe they're struggling with their oral hygiene at home. And then I see cavities like this that are on the facial margins around these teeth. This tells me that there is just a very, very high caries risk because of one or the other reason, right? So, based on these pictures, maybe you're thinking that, oh, there must be something in this patient's medical history that explains what's going on. But this is what we received from him, right? 38-year-old male, he's unemployed, lives with his mom, recently went to another dentist, and he said they pulled out so many teeth. I need to have those replaced. I need my remaining teeth to be fixed so I can find a job. And medical history is within normal limits. Something seems to be missing, right? This seems like a regular guy who just needs to find a job, but has this dentition which is extremely, extremely decayed and it's not matching his social history or his clinical presentation. Something seems to be missing here. What is missing? Turns out he was a chronic alcoholic and he was really, really just trying to quit. His family had tried to send him to rehab twice, but he ran away, which means that he didn't finish completing his rehabilitation. He would binge drink and eat every single night and would always, always be extremely tired in the mornings because of that. Was receiving care at home from his mom and very, very loving family support system. Obviously, lots of dentistry needs to be accomplished here. There's lots of fillings, lots of crowns. We need to do partials, cleanings. There's a lot of stuff that needs to be accomplished. How do you proceed with this situation? How do you treatment plan here? What potential problems are you anticipating during treatment? How do you secure your dentistry? I'm kind of talking about prevention again. You might do all of this treatment and it looks fantastic, and then you see the patient at a recall, and if you haven't really bothered doing a lot of oral hygiene instructions, education, you might see that dentistry starting to fail, and that is super duper frustrating. Um, how do you prevent further decay? So, one of the things that I want to actually share about this patient, which has nothing to do with prevention, is basically the timing of treatment, because we actually did not realize this until maybe we were midway through his treatment plan. Whenever we saw him in the mornings, he would always be super, super tired because of his habitual drinking and binge eating the night before. So, towards the middle of his treatment plan, we actually started scheduling his appointments in the afternoon. So, he's had enough time to wake up, feel rested, he's had some breakfast, he's doing okay, and then he can be ready for us for his dental appointment. That's number one. Two, most patients who have had some form of alcohol abuse in their lives are going to be very, very challenging to numb, especially if they have just gone through a drinking session the night before. So we actually had to work with his uncle to make sure that he got enough rest the night before, which means that he tried to stay away from drinking as much as possible so that he would be easier to numb the next day. Because I noticed that right away that I would be numbing him constantly, have all of this medication ready to go, and then I would be out. I would say that, oh, based on your body type, your body weight, I can't give you more anesthetic, which means that I can't do more treatment, which is a complete waste of time for us because we set up anticipating that I will finish maybe a quadrant's worth of dentistry, but if I'm only able to get maybe one tooth done in that time, it's really, really unsuccessful for us as well. Because at the end of the day, it has to make sense for everyone. It has to work for our patients. It has to be beneficial for us too. So, um, changing the timing of his treatment, working with his family to make sure that he was getting enough rest and not drinking the night before helped our procedures go a lot smoother. And that's actually one of the key elements that I wanted to bring up during this phase. And again, we would have never known about these first two or three points had we not been Sherlock Holmes and asked more questions. So, really, the key takeaways are that when the clinical presentation is not matching the medical history, you have to try and figure out what is the missing connection. Ask more questions. Sometimes patients will reveal the answers, and sometimes maybe a family member will perk up and give you feedback or add something to the conversation that helps you realize what's going on. Protect your efforts. This is so important. I have been burnt several times by seeing this in practice where my dentistry just has failed 6, 9 months later. And it's because we just did not have the time to go over oral hygiene instructions. And that's why it's one of the most important things that we discuss now, and we discuss it at the first appointment. Engage caregivers and families as early as possible. They are a wealth of resources. It might not seem like that at the first visit, but once you pepper them with questions, they will give you answers. Be very strict about home care, keep realistic goals for each appointment, and of course, do not take anything personally. So sometimes I remember with this specific patient, the first 1 or 2 times, I was just unsuccessful in getting him numb. And I took it very personally, thinking, is there something wrong with the way I'm numbing this patient? Because it seems to work for every other patient but him. Um, but then I realized that, you know what, his medical conditions are completely out of my control. I might be the best at numbing someone, but I will still not be successful because his medical conditions are working against my efforts right now. So once we understood that, we realized what to do. Also, a lot of patients with behavioral issues, you might see this sometimes with patients with dementia, they can appear very, very rude and mean to you and might say things that could be very hurtful. Never ever take it personally. Always tell yourself it's the disease, it's not the person, and it's definitely not about me. It's never, never, never about you. So remember that you are coming from a good place. You're trying to do your best to serve these patients, but sometimes the disease talks badly to you and it's not the patient. So don't take it personally. Thank you, and I hope you enjoyed that module. I will meet you in the next one.